Thank you for joining me for the Continuum of Care new user training. This training was created in collaboration with ECHO's Community Planning and Partnership Department. My name is Andrew Willard and I am the Procurement and Performance Manager here at ECHO. Today we're hoping to go over the Continuum of Care responsibilities and governance structure to get a general understanding of the homelessness response system here in Austin, and then briefly to go over the annual Continuum of Care Notice of Funding Availability, or NOFA. So let's start out with what is the Continuum of Care. The term Continuum of Care, or COC, is used in many different ways and can refer to the planning process, the collection of stakeholders involved in the planning process, the geographic area covered by the COC, or the actual grant received from HUD by a service provider. The COC planning process is typically led and staffed by either a local government agency or a community-based nonprofit. The geography covered by a COC can vary, sometimes covering an entire city, states, or even just a collection of counties. The goal of the COC is to create a system-wide response to ensure that homelessness is rare, brief, and non-recurring. The COC is tasked with compiling information about homelessness in the community, including information about homeless populations and the performance of homeless service programs and the community's progress in reducing homelessness. In Austin, the COC planning process is led by ECHO, and ECHO has been directed and empowered and follows the direction of the COC board and the COC governance structure. The Continuum of Care process was developed by HUD in 1994 to coordinate the distribution of several competitive homeless assistance programs. Prior to the COC process, organizations applied individually for funding from several different local assistance programs. As a result, there was little coordination between these programs or between different organizations receiving funding in the same community. This frequently led to a silo of efforts and kind of disjointed activities among service providers. The COC process was established to promote coordination within communities and between programs. It was also designed to bring together a broad collection of stakeholders, such as public agencies, the faith and business communities, and mainstream service providers. Guidelines for the COC planning process were included in the annual Notice of Funding Availability. HUD regularly modifies the COC planning process as well as the Notice of Funding Availability annually. 24 CFR 578, which is the federal regulation that governs the Continuum of Care program, outlines 5 primary things and activities that Continuum of Care have to include, and that's the identification of an HMIS lead agency, the creation of a COC board, the establishment of a governance charter to oversee the COC governance structure, the identification of general membership and the inclusion of general membership in activities carried out by the COC, as well as the designation by the COC of a collaborative applicant to annually respond to the NOFA's request and submit all of the projects hoping to seek funding from the COC program. In Austin, ECHO is both the HMIS lead agency, so tasked with the maintenance and training and technical assistance related to our HMIS system. It is also the collaborative applicant, so ECHO is in charge of annually carrying out the facilitation of the local competition of COC funds as dictated and established by the policies that the COC board has approved. We also have a governance charter which outlines the COC's governance structure. The Leadership Council is the COC board of the Austin Travis County Continuum of Care. And we identify that in our charter, any stakeholder is an individual or organization with an interest in understanding and addressing the issues related to homelessness and a desire to participate in some way in the Austin Travis County plan to end homelessness. The COC board, the Leadership Council, shall include community representatives within the geographic area of the Continuum of Care who are homeless or formerly homeless individuals, as well as representatives of relevant organizations and projects serving the homeless populations. So this should include and does include businesses, representatives from behavioral health, primary health, criminal justice and law enforcement, permanent housing providers, interim housing providers, City of Austin, Public Housing Administration, the City of Austin Housing Planning Department, as well as representatives from employment and committee chairs. The current Leadership Council is composed of no more than 15 seats. 4 seats are appointed. That is going to be an appointment from Travis County as a local government representative, the City of Austin Homelessness Strategy Officer, the City of Austin Equity Officer and/or the Civil Rights Office. Each hold a chair. There's also a representative from the Housing Authority of the City of Austin. It has no term limit. Additional elected officials are reviewed as terms expire, and those include a representative from a HUD-funded service provider, a representative from a service provider that does not receive HUD funding, a representative from a healthcare or disability seat, a mental health and substance abuse representative, education and workforce development representative, some other funder representative, 3 seats for individuals with expertise, especially one for youth or young adult, and then 2 other elected seats, which are used to fill in minimal representation from other seats. As elected members' terms expire, they have the option to go in for a 3rd year. As terms or seats are vacated, the COC Leadership Council can appoint an individual to fill the spot until the next general stakeholder meeting, at which point any vacated seats will be elected to begin their term. The 2021 Austin-Travis County Continuum of Care Homelessness Response System Leadership Council is composed of 13 members from across the community. That includes Diana Gray as the City of Austin Homeless Strategy Officer, Brian Oakes, the City of Austin Chief Equity Officer, Kathy McCarty, who is the Travis County Planning Manager, Lisa Garcia, who is the Vice President of Assisted Housing for the Housing Authority of the City of Austin, Jason Phillips from Caritas of Austin, Emily Seals representing Sunrise Homeless Navigation Center, Winnie Thurman with the City of Austin, Ruth Aharn with Integral Care, Summer Wright from the Austin Youth Collective, Riazan Morris as a community advocate, Richard Johnson as a community advocate, Devin Harris with the Black Trans Leadership of Austin, and then Quincy Dunlap with the Austin Area Urban League. The Leadership Council establishes and manages various committees and work groups to achieve community goals, establish policies and procedures, monitor system and project performance, and establishes community funding priorities for the homelessness response system. The COC governance structure is the mechanism by which the goals and strategic direction established by the Leadership Council is carried out in our community. The Leadership Council also liaises with other groups beyond the Continuum of Care governance structure to coordinate efforts and activities, specifically the City of Austin or Travis County, the City of Austin's Austin Public Health Office, or as the ESG recipient, as well as the Housing Planning Department as the CDBG and HOPWA designated recipient for the community. So this is a brief example of our homelessness response system map here in Austin. At the bottom, you'll see individuals who are experiencing unsheltered homelessness and their pathways to permanent housing. While some individuals are able to exit unsheltered homelessness on their own, other individuals might be connected to our system by outreach teams or entering into an emergency shelter. These individuals are then also, if they are unable to exit homelessness at those points, they might complete a coordinated entry assessment, which would connect them either to temporary housing programs like transitional housing or permanent supportive housing, or permanent housing programs such as rapid rehousing or permanent supportive housing, all with the goal of essentially assisting someone from exiting unsheltered homelessness to permanent stable housing. What is homelessness? The Austin-Travis County Homelessness Response System primarily assists individuals experiencing literal homelessness. The larger Community Crisis Response System assists those at risk of homelessness or in a financial crisis. The Department of Housing and Urban Development defines homelessness within 4 categories. Generally, individuals who are eligible for services fall within Category 1, literal homelessness, or Category 4, fleeing domestic violence. For literal homelessness, an individual or family who lacks a fixed, regular, and adequate nighttime residence, meaning has a primary nighttime residence that is a public or private place not meant for human habitation, is living in a public or privately operated shelter designated to provide temporary living arrangements, or is exiting an institution where he or she has resided for 90 days or less, and who resides in an emergency shelter or place not meant for human habitation immediately before entering the institution. Category 4, which is fleeing or attempting to flee domestic violence. Any individual or family who is fleeing or is attempting to flee domestic violence, has no other residence, and lacks the resources or support networks to obtain these permanent housings. Primarily for funds which are designated to assist those experiencing homelessness, Category 1 or 4 is used to determine if they are eligible for the program, as well as guides how records should be kept to qualify that individuals meet these definitions. In our system, there are some programs that serve beyond Category 1 or 4, or might even serve at risk, but primarily efforts to assist those experiencing homelessness are directed for those experiencing literal homelessness or fleeing or attempting to flee domestic violence under these categories. 24 CFR 578, which again is the regulation that lays out the responsibilities and allowabilities of a continuum of care, does require that continuums of care establish a coordinated entry system or a coordinated assessment system. The United States Interagency Council on Homelessness, their Opening Doors, which is the federal strategy to end homelessness, says that the coordinated entry system is an important process through which people experiencing or at risk of homelessness can access the crisis response system in a streamlined way, have their strengths and needs quickly assessed, and quickly connect to appropriate tailored housing and mainstream services within the community or designated region. A standardized assessment tool and practices used within the local coordinated entry process take into account the unique needs of children, their families, as well as youth. When possible, the assessment provides the ability for households to gain access to the best options to address their needs, incorporating participants' choice rather than being evaluated for a single program within the system. The most intensive interventions are prioritized for those with the highest needs. Locally, the coordinated entry system is managed by the Coordinated Entry Written Standards, which were most recently updated by the Membership Council in March 2019. Membership Council has historically appointed ECHO as the entity responsible for facilitating and coordinating the coordinated entry system. The coordinated entry system was designed to ensure that no matter where an individual in our geographic area is experiencing homelessness, they could be assessed and prioritized and referred to an appropriate housing intervention. There are 4 primary stages of coordinated entry: access, assessment, prioritization, and referral. ECHO, coordinated entry and outreach navigation staff, community outreach teams, and coordinated entry partner organizations market services to participate as the access portion of a coordinated entry system. Service providers and different websites and outreach tools are used to ensure that individuals, regardless of location or ability, are able to access the coordinated entry system and communicate to the system their desire for increased assistance exiting homelessness. Currently, individuals and their families complete the universal data elements, the Vulnerability Index Service Prioritization Determination Tool, a housing navigation assessment, and equity questions to determine their need and appropriateness for available intervention types. That would be the assessment portion of the coordinated entry. Following the policies and procedures approved in the coordinated entry written standards, as they were designated by the membership council, individuals are then prioritized for services and interventions based on their assessment results. The prioritization in our community does and should shift in response to community needs and situations. As projects identify their capacity, participants are referred to the appropriate intervention types for eligibility screening, services, and housing support. Individuals can currently access the coordinating tree system at most shelters, as well as at the Goodwill of Central Texas or the Southeast Health and Wellness Clinic. Individuals are also encouraged to update their coordinating tree information every 6 months and keep their contact information up to date. Annually, HUD releases the Continuum of Care Program Notice of a Funding Availability, or NOFA. The COC is responsible for carrying out the NOFA and responding to it. The NOFA is how communities are able to utilize COC program funds to fund permanent supportive housing programs, rapid rehousing programs, transitional housing, joint transitional housing, rapid rehousing, supportive services, or the homelessness management information system. The COC is also responsible, and the cooperative applicant, being ECHO, is responsible for completing the planning application and ensuring that the results of the local competition and the planning application are submitted to HUD in response to the NOFA. ECHO also provides the following supportive services to the community: facilitates the coordinating tree training and work groups, such as the PSH work group and rapid rehousing work group, which is primarily done by the coordinating entry team; to assist with the development of landlord relations and the available housing stock by the community housing team; coordinates community trainings and provides programmatic technical assistance to program, that's the planning and partnership department; and also provides HMIS training, supported system data quality, and the HMIS technical assistance by the HMIS team. The research and evaluation department also supports system and project level data analysis and system modeling for future needs. Thank you for this presentation. If you have any questions or concerns, feel free to email ECHO's Community Planning and Partnership Department at nofa@austinecho.org. Again, that's NOFA at austinecho.org. Thank you very much.